We are broadcasting from on site at Eleusinia, about to start a new retreat, and we have some really cool things to talk about today.
Yeah, and it's our new studio, so you can expect to see more of us exactly like this, talking in between retreats, talking about things that are important to, let's say, the industry, the retreat space.
And what has been coming up and what is incredibly fascinating to us lately.
Well, today I would like to talk about DMT. Because DMT has a pretty significant, well-deserved in some ways and not so deserved in other ways, a very significant reputation for being an extremely strong psychedelic, something that only the thrill seekers go after, something that is so intense, difficult to find, et cetera, that I think that it gets in the way of really thinking about how this substance can benefit someone's quality of life. Because it's really a big part of my care program, how I take care of my neurological condition.
Yeah, so we often find that guests show up and they're like, why DMT? And they're really surprised how important it can be. So can you tell us a little bit about your experience and why it became important?
Well, psilocybin is how I got started with treating my hemicrania continua. And it was very, very useful, very, very impactful. It was pretty much what brought me back to life, raised me from the dead. I went from being completely treatment resistant to having basically the normal everyday life with psilocybin. But I don't think that if I was reliant only on psilocybin, that I would be able to keep up with this. I mean, I'm an active person now. I run a whole retreat. I do a lot of traveling. I do a lot of stuff that if every time I felt this headache starting to creep back, I'd say, no, clear my schedule. I need one full day to dedicate to having the psilocybin experience just so that I can retain a certain amount of normalcy. And DMT is a quick experience. It's 15, 20 minutes for me, that's my experience at most, even though I know that it can last longer for some people. But it's easier for me to find 15 minutes to dedicate to maintaining my headache prevention and my headache treatment than it is for me to say I'm going to spend a full day having a psilocybin experience and recovering from that psilocybin experience.
So I agree with you. It's really helpful for that reason. And if you look back in the history in the 1960s, they called it the businessman's trip because it was so short acting. But it has a lot of important cascades and there's a lot of current research. And that really leads into the why we use it, why it's so important. Can you tell us a little bit about why it started at Eleusinia, why you brought it in for the experience here?
I got interested in DMT because I had heard that it was helping a lot of my brothers and sisters in the headache world with cluster headaches, that people were using it as an abortive. An abortive, for those who are not really familiar with headache treatments, is that the treatments fall into two categories: something that you take every day or something that you take on a regular basis that works as a preventative that hopefully helps keep you from having these attacks. And then there's also like an abortive. That means that attack has already started. You're in the middle of a migraine, in the middle of a cluster attack, and that you need something to stop it in its tracks. Now, abortives never worked for me with hemicrania continua because abortives usually, there's something you take at the beginning of an attack. And now when your attack is continuous, like it doesn't have a start, doesn't have a finish, at what point does that abortive fit in there? But so my first interest was not really for myself at all, because like abortives never worked for me. What would make me think that this is going to be any different for me? So my interest was really in being able to offer something to our visitors that have cluster headaches. And then, yes, curiosity got me. I gave it a try. And I also found that if I used it, that I would get more time in between when I would have to take the psilocybin. It was like buying me a little bit extra time.
So, as the medical coordinator here, I've seen a lot of amazing things with DMT. And there's a multitude of guests that we have, and they kind of range in different categories. And we do get a lot of guests for pain, for headaches, but also for mental health, and some just for the explorers that just want to check this out.
Right.
But leaning more towards the medical reasons and the amazing things that I've seen here personally is I really wanted to share how shocking and how surprising it is to have a guest here who has an onset of an intense migraine, 10 out of 10, or another type of headache, a neuropathic.
Trigeminal neuralgia, occipital neuralgia.
Exactly. And then not be able to get out of their room, not even having trouble asking for help, wanting nothing more. They call them the suicide headaches for a reason, because it is so excruciating. And, I've worked in the hospital for 16 years and in the ICU. So I've given lots of drugs, Dilaudid, so many things. And I cannot believe what I've seen. And the guests can't either when they sit and work with DMT, and it'll remove the headache. It'll completely eliminate the pain with zero reoccurrence.
It is a very strong, just feel like a reset to the nervous system. And it is really impressive. But I did want to cover a little bit more what you were talking about in the beginning. One of the things about psychedelics that it completely impresses me is that it is not just something for the ill. It's very rare that you have a condition, something that is painful or wrong with you, that you get to share the experience of the treatment with the people around you that are well, and it also improves their wellness. It is a tool that someone can use to improve their wellness, no matter where their starting point is. Going through my earlier treatments with hemicrania continua was very isolating. When you're there in that hospital bed, you're all by yourself. Your pain meds or your whatever meds you're taking, that's only you. Or whatever experience that you're having, you're sort of set aside. Like this is something that's just for the ill. But when I started with psychedelics, it changed because it was something my husband could also experience. It's something that we could relate to on. So that applies also to DMT. I would say that the techniques for someone looking to use DMT for physical pain are a little bit different, because you don't have to always go into that full-on, a complete different dimension type of experience. I can take enough that just covers about, let's say, 2 minutes of an experience, and then just move on with my day. It doesn't have to be something where you're completely immersed.
And another thing that I know that is a part of your practice is that even if you were to wake up in the middle of the night, it's something that you could have by your bedside, because it's so short acting and it doesn't interfere with sleep like taking psilocybin at night can.
It does. But something that I would like to talk a little bit more about, the attitudes or the impressions that people have about DMT within society, within what comes up when someone thinks about DMT. They think about this something that's super extreme, that only the daredevils do, but hasn't been my experience so far.
Yeah, absolutely. So you're saying it hasn't been your experience because you're able to use it as a practice for your health, for well-being, and for headaches. And it's not
if you take a large dose of DMT, it is definitely something quite extreme and very intense, that I would say, yes, I put that when you're ready to be a daredevil, go on for that. But DMT, I think, is something that is, when it comes to managing physical pain and that type of thing, it is, you can think of it almost as a microdosing type of practice, something that's very, very brief, very, very small. And it can help with these attacks.
So you're saying that the culture around it, really, they discuss it as this huge big deal. You'll hear about DMT on all the podcasts, and they're talking about this incredible, leave your body experience. But there's
aliens, entities, all sorts of you go to a different planet, all these things. Which, look, I'm not saying it's beyond the realm of possibility. Yes, this has been the average intense DMT experience, but I'm saying that's not the only role that it can play.
So it's interesting because our guests show up and we generally have a large amount of an older population ranging from 60s, 70s, and 80s. And many of them have never inhaled any substance before. Some have never been smokers. So we educate them as to the benefits, and we help them learn how to smoke, because this is going to be a process that the route of administration is inhaled.
Yes, because DMT is very, very delicate. And if it's not either put in like an IV or vaporized, like in the process of smoking, then it doesn't really have much of an effect. It's not something that you can just eat. It has to be smoked.
Did you ever think that this was going to be part of your job description, is teaching 70-year-olds how to smoke?
For the first time? No, and it's something that I had to really sit back and say, okay, well, if I had to teach someone how to smoke, how would I do it? Explaining the part about the puff and then the inhale afterwards, how to avoid any type of, because vaporized DMT is not really very harsh at all. It's a very, very smooth. It's not very irritating. But anything that you smoke, if you let it just sort of sit there in the nasal cavities or hang out there in your throat, is going to cause some coughing. So yes, if you told me 5 years ago that I would be teaching someone old enough to be my parent or even a grandparent that I would be teaching them how to smoke, I would have laughed you out of the room.
So we have these amazing guests, and they just have a really good attitude about learning, because there's also a lot of research coming out, especially in the Netherlands right now, about post-stroke helping heal the brain. So can you tell us a little bit of the reason of why it's healthy, and for not only those that are in pain or possibly preventing stroke, but also for those healthy normals?
Well, yes. First off, all classic psychedelics have a very strong anti-inflammatory effect. They have this, and also an anti-inflammatory that works on the brain. So it's something that crosses the blood-brain barrier and reduces inflammation in the brain. And most neurodegenerative diseases are based in inflammation, whether you're talking about different types of dementia or Parkinson, MS, all of them have a basis in inflammation. So when you do have exposure to a psychedelic, you take a psychedelic, there is a strong anti-inflammatory effect. Now, DMT takes it one step further because it also stimulates another receptor, not the one that's commonly associated with psychedelics, the 5-HT2A receptor. It also stimulates the sigma-1 receptor, which makes it even a stronger anti-inflammatory effect.
So we just recently had a guest who wasn't able to shave his face because he wasn't able to lift his arm because of a neuropathic pain. Mm-hmm. And after his experience here, especially after DMT day, all of a sudden he comes out of his room and his face is shaven for the first time in 5 years.
Oh yeah, we barely recognized him.
So it is incredible. So we do see this mechanism of action. And I feel like we're talking a lot about the research, and there's a lot to do, and we're really, really excited about it. But what we didn't get into quite yet is those that are here for treatment-resistant depression, for those more anxiety.
Can you rewind? Because we were talking a little bit about the stroke research. I didn't really cover that too. So when you do have a stroke, there is quite a bit of tissue damage, and we don't really have great tools for recovering that or preventing that. And there are some active clinical trials now using IV DMT to protect brain tissue after a stroke.
And to be specific, they're using levels that aren't inducing a very, very strong threshold of the psychedelic experience. So it's going to be really interesting to see how
Could you imagine that, being in the middle of a stroke, or recently having a stroke, and then, here are the aliens now? No.
Yeah, so I think that's
I imagine they're getting the same sort of level that I do when I have those nighttime attacks, which is it only takes maybe one or two puffs, light puffs on that vape pen, and the experience lasts 3 minutes or so, 3 to 5 minutes at most. And I would describe it as just having a little bit of a light show as soon as you close your eyes. Nothing really intense or dissociative like that.
And what you haven't mentioned is the feeling that oftentimes people will move into a DMT experience and just feel really joyous, light, refreshed. Can you explain why you think the mechanism, how is it working
Oh,
there?
I have no idea. But I recognize, and I can relate to that 100%, that after a psilocybin experience, you can often feel exhausted, and also a little bit vulnerable, a little bit soft around the edges, and just overall exhausted, not really ready for anything. But after a DMT experience, you do feel like you could take on the world.
It is amazing. And yeah, so you have this ability to, can you talk a little bit about how important it is for you to continue your psilocybin dosing and how you can also use DMT to help stretch that time?
I just sort of sprinkle it in, having little mild sessions like that. I generally get about 3 weeks pain-free time per psilocybin dose.
And, you have a busy life.
Yes, I have a busy life, and then trying to fit in another full day of, okay, I'm going to spend this time having a psilocybin experience is tough to find that time. So what I do is I'll just sort of squeeze that time out by throwing in a few DMT experiences along the way.
So both tools are really valuable for you. So the psilocybin is going to be it has it's a little bit more durable as far as your pain relief and relief. And
I feel like I get more time out of the psilocybin. Out of the psilocybin experience. That's what I feel.
But the DMT is an essential tool because it's so short acting and can give you that
yes.
benefit. So that's really wonderful. And as you mentioned, you don't have that sense of the self-care required for the container for the psilocybin experience. It's so short acting that you can get up and move about your day and feel pretty empowered and pain-free. Mm-hmm. So
but let's talk a little bit about it, on a mental health, on the mental health side, because you have more experience with that, both with our guest and yes, personally, I think that it's not something that is close to home for me.
Right. So there was a reason, and this is aligned with that we also wanted to bring in DMT to Eleusinia really is because oftentimes we have guests that are on medications and they are blockers. So DMT is unique because it more accurately or acutely fits onto the receptors than psilocybin does even. So often what we'll do is the receptors that have been used to kind of being blocked or are not fresh and ready for a psychedelic experience will have the macrodose experience. And if their experience isn't really deep, what that tells us is that their receptors need a little bit more activation. And the DMT can do that really well. So we have 3 psychedelic experiences here. And all of that is a reason to really dive into the education of where our receptors at, what our personal dose may be, and to just reawaken, blow the doors of perception open so that when we work with it on a not continuous, but weave it into our self-care practice, we can do that in a really self-aware way.
Okay. So, a lot of retreats do offer DMT. DMT is it's the active ingredient in ayahuasca too. There are quite a few retreats that offer NDMT, 5-MeO DMT, and so what do you think about that?
Well, what makes our retreat different is that, first of all, we really target the risk adverse and people who are nervous. And so we're moving through psychedelic experiences with people that have had a lot of life experiences, either with pain or with just treatment-resistant diagnoses that are really, really difficult. So they're weathered, worn down, and they don't necessarily find any hope in Western medicine any longer. So there tends to be quite a few of that. What makes us really special is that we really aim on education and harm reduction and integration, also with empowerment. So we're teaching you how to be self-aware, more about mindfulness, how to navigate your own mental health, and also with our community that we build afterwards with our support.
Well, okay, I'm going to clarify a little bit more on that then. Okay. So I have concerns that when, let's say there's more and more research will come out talking about the neuroprotective effects of DMT, the neuroprotective effects of psilocybin, and then we will have many retreats popping up, many places that offer something like this and saying, okay, come and do this and protect your brain. But I don't think that, I don't think enough emphasis is put on the fact that these anti-inflammatory effects, the stimulation of neuroplasticity, is rather short-lived. Mm-hmm. And if someone thinks that I'm going to go to a psilocybin retreat, or I'm going to go to an ayahuasca retreat, and this one visit is going to protect me from Alzheimer's, it's going to protect me from dementia, it's going to improve my brain health in the long term, it doesn't work that way.
Yeah, there's a lot of misinformation there.
It just doesn't work that way. It would be like, okay, I'm going to go and just take, like when you go to the doctor for some sort of inflammatory condition, they give you a pack of steroids that you continue over a certain number of days. Taking one of those pills just one time isn't really going to help anyone. Just like having one DMT experience, one ayahuasca retreat, one of these things one time, or even separated by multiple months, is not going to have a significant impact on someone's level of neuroinflammation.
Yes, so there is a possibility that there are a few people that really do have a changed life experience from one and done, but it does seem to be the rarity. So our approach really teaches the empowered approach. So that's why it's so important that we started teaching people how to cultivate their own mushrooms.
We have a DMT extraction class because keeping up with it, and there is a theory that having multiple experiences, especially not too spread out too far apart, will achieve some epigenetic changes and change your propensity for this level of inflammation. Whether this inflammation you're talking about in like your brain, like neuroinflammation, or inflammation in the blood vessels, circulatory system.
And we have had guests with dementia, and it's been amazing to see how they're continuing with the help of their families to weave in a practice with both psilocybin and DMT. And so that education is absolutely crucial. Mm-hmm. It's very important for people to know that they're not coming for a circus ride. That is not what we're here for. We're here to set you up for success. So the amount of education...
It's not a singular experience. It's about learning how to use a tool to benefit yourself on a consistent basis afterwards.
So yeah, going back to the ayahuasca ceremony, this is a one and done. You can't call up the shaman because you learn how to do it and move through an ayahuasca. I do have experience with ayahuasca, and you do feel amazing for 3 months, but then what? You have to find another retreat. Now, our goal is really so that you don't have to come back, but interestingly enough, we have so many guests come back.
But then on a physical level, like the impact from that one single experience is not going to last 3 months. You might have a psychological impact for 3 months where you feel, it's the same thing with psilocybin. The studies are showing that, 3 to 6 months is and the effects will last about that long. But to get that physical impact of lowered inflammation, it's going to take more of a sustained type of practice.
And there's a lot to be said about where your receptors are at. Are they sensitized? Are they not really available? And so a lot of our guests have this huge range of experience. So it's really interesting to see them move through the macrodose, then have an integration day that includes massages and talking to multiple people, multiple professionals, and then moving into the DMT experience. And what I see commonly happen in integration is that it really kind of, for the people that are coming for more emotional reasons, or they're moving through deep grief, for example, they can really, what they didn't quite get all the way in their psilocybin experience, they can kind of finish off in their DMT. So it's a really beautiful blend to see both happening.
Yes. Due to certain medications, especially sustained use of certain medications over many years, with that first psilocybin experience, it's pretty common. Even the best, we try to avoid it. Sometimes it happens that people don't get a significantly impactful experience from that. But in my experience so far, nothing has stood up to DMT. Especially because it's self-administered. You keep on puffing until you feel yourself starting to approach that threshold.
Yes, and going back to a little bit of the mental health, some of the other benefits that we haven't talked to is that it can interrupt obsessive rumination. And more specifically, it can interrupt obsessive suicide ideation. And I've seen this personally as a medical coordinator here, and it's just blown my mind. People who have come that already have a plan when they leave retreat, but to see that start to break up with DMT it's just unbelievable.
Mm-hmm. So how does DMT fit into your personal practice?
Well, the education of starting to extract is where I'm at right now in the process. And so I also am sort of similar. I like to have a macrodose, which my receptors are a little bit sensitized at this point. So that's about 2 grams for me once a month. That's my ideal. So I haven't quite weaved it in, but I'm really looking forward to seeing how it goes. And I think it's a very essential tool, like especially as a mother of adult boys. If anything were to happen to where they were in a spot that was so low, I would have it on hand, just because I could help them break that suicide ideation. I mean, we don't have any tools. We recently had a guest that was feeling very suicidal. And so he went through this whole rabbit hole of calling 911, getting picked up by an ambulance, having to be locked up for 24 hours. And it didn't in no way did it help him shift or be supportive. So there is a lot of education and more research and more support that we can help for these people that are in these really, really painful mindsets.
Yes, I personally have not struggled with like the mental health or the suicidal ideation, but just from my experience of just being there, I can feel it's like it is a strong reset. And I can say whatever I was thinking of before that session, I might not have been thinking about it afterwards.
I have had a lot of fun recently with getting more intentional. And, we teach here at Eleusinia, we want you to learn the tools before you get too intentional.
Yeah, but Tawnya, at this point,
Yeah.
At this point, you're very, very, very familiar with the tools. I think
right. So I am able to, like, if you get too complicated with your intentions, you're not going to go anywhere.
Because intention shouldn't be a to-do list.
Right, exactly. And if it's a long sentence, like, I'm doing this because I want to see angels, forget it. But I have found, like, before I work with DMT, if I can say one word like compassion, or even something like support, love, or even ancestors, I've dropped into spaces that were really associated with that. So I'm having this really amazing thing happen where I'm able to navigate. And I've helped a few guests. It doesn't work for everybody, but some people who have one word that they want to work with, they can use that one word and move into that experience. So it doesn't have to be just this off on of just a variety of colors and experiences. You can kind of tie it in when you're ready.
Okay. So I would say there's just a good takeaway from this episode is that DMT is not like this intense, only has to be intense, only for the daredevils out there. It is a tool that, it's a powerful tool, but there is a way to scale this in a way that is impactful for even, like, you can imagine, even if you're someone who can imagine, like, I would not be the person who does DMT. This can be a tool that protects you from neurodegenerative diseases. It can be a strong anti-inflammatory. It can have significant impact on mental health. It's not something that is just for the daredevil extreme thrill seeker.
Absolutely. And
although it can be something for the daredevil extreme thrill seeker, because, we offer DMT in 2 forms at the retreat. One of them is pure straight up DMT that is actually smoked out of a pipe. And it is a perfectly 100% pure, so it has a very fast uptake, very fast action, and it has it's quite intense. Now, what you can also do at the retreat is we have DMT in we dissolve it into a vape liquid. So a vaping liquid, and it's much more diluted that way. So, and that's what I use when I need like the pain rescue, something like that, something that I need to be able to manage myself on my own. It is diluted to the point that I have a little bit more control. It's not like that one puff thing and then you are off into the stars. It takes a few. It actually takes a bit of work and concentration to get in enough puffs to get really a true threshold experience from the vape pen. But yes, that's we use those two different delivery methods so that we have something available for the thrill seeker, and we also have something available for someone who's looking to use this independently. And a lot of people that come to the retreat actually end up trying both, because we all have a little bit of a thrill seeker in us. When someone says this takes you to another dimension and you get to see aliens, okay, great.
When you feel
I want to
safe
see
enough.
aliens because I'm here with people that are supporting me, and I have support, and I can explore that. But in the process of like thinking, okay, how am I going to make this sustainable at home? What am I going to do? Then having the vape pen and knowing how it works, knowing how to make your own vape juice, the liquid that goes inside the vape pen, it becomes very, very, very useful.
And I just want to be clear about the two main different types of DMT that's out there.
Oh, yeah, because there's a little bit of confusion with that.
There
right?
is one that comes from a toad venom, and that's 5-MeO DMT. That is not what we're talking about here. Right.
So there are two types of DMT, 5-MeO DMT. I think there are actually more, but the ones that are most well known are the NDMT, which has a plant base. It's made from something called Mimosa teniflora, or here in Mexico, we call it tepescoite. And that one it's quite strong, but 5-MeO DMT is actually a bit stronger. The NDMT has the ability to stimulate that receptor as much as your natural endogenous serotonin. 5-MeO DMT even extends beyond that. So there is a bit more of a risk of toxicity involved with 5-MeO DMT. Well, there's pretty much none related to NDMT.
Yes, thank you for clarifying.
Because your body is only built to handle your endogenous serotonin. Passing that up for something that is even stronger could result in loss of consciousness, inability to control certain bodily functions, that sort of thing. So the type of DMT that we use is NDMT, which has a little bit of that safety net.
Yeah, and we really want to demystify DMT, but it's still really important that you're starting this process or learning about it in a really safe container where you feel safe and where there's lots of education and that's backed by research.
Right.
But what we do find often is that it's just so surprising to guests that it's not what they expected, because they hear so much in the media about other forms. So
when guests are thinking, coming to ask about the DMT, first, what have you heard about it so far? Because if you look up DMT online, what's the DMT experience like? It is quite intense and sounds like you teleported to a different dimension. You met aliens, you interacted with some elves or something, and that's on the table. I'm not saying it's not on the table. It's definitely a possibility. That's something that it's dose dependent, and it's not like that all the time.
Yeah, so here's to having healthy, available receptors so that we can continue on this journey in a really healthy, mindful, educated way.
Yeah, it was a great talk.
Yeah, thank you.